Good afternoon, everyone. Thank you so much for joining us. My name is Erin Choquette, and I'm the CEO of the Connecticut Paid Leave Authority. And with me today are Representative Geraldo Reyes, Representative Manny Sanchez, and Representative Hilda Santiago. We're here to talk about the Connecticut Paid Leave Program and to make sure that everybody in our state knows that these benefits are available to you if you need time off because you're caring for yourself when you're sick, you're caring for a family member, you're adding a new member to your family. The benefits that we provide can help you pay your bills during those times of great change in your life. Connecticut FMLA provides the job protected leave, and that's something that you request from your employer to make sure that your job is available when you need to come back to work. But not every employer provides paid time off, and that's where we come in. Connecticut workers pay 0.5% of their wages into the Connecticut Paid Leave Trust, and we use that fund to pay for the benefits that help our friends, our neighbors, our coworkers get through those difficult times. Workers are eligible for the Connecticut Paid Leave Program if they work for private sector employers in Connecticut of one or more employees, so small employers are covered. Part-time workers are covered, seasonal workers are covered. You simply have to earn $2,325 in your highest earning quarter in the base period, which is something that even if you're working minimum wage, say 20 hours a week, you can make that number. Our program started providing benefits in January of 2022. You may remember if you were looking at your pay stubs, we started taking those deductions in 2021. And all of this came about as a result of the Connecticut Paid Leave Act, which was signed into law by Governor Lamont in 2019 after many, many years of advocacy and work from many people who are in this room, including some of the legislators sitting to my right. So I want to thank you for being here with us today and for sharing your experiences with time off and the importance of paid leave. But first, Representative Sanchez, the Labor Committee is our committee of cognizance. We work closely with you, and one of the things that I think is really important to know is that paid leave benefits not just workers, but their families and businesses. Would you please talk about the benefits that come from the paid leave program?
Thank you, Erin. As she mentioned, I'm Representative Manny Sanchez. I represent the 24th District, which encompasses New Britain. As chair of the Labor and Public Employees Committee, I believe CT paid leave will bring great benefits, not just individual workers and their families, but also businesses throughout the state. As mentioned, paid leave provides workers with income replacement benefits when they need to take time off for certain family or health reasons like having a baby or taking care of a sick loved one, as we've heard many examples of many times. Paid leave also has been proven to affect our economy and businesses by improving retention and boosting labor force participation. This program makes Connecticut a more friendly family state, and one that we can take comfort in the fact that you can raise your young family here, you can care and be a caregiver for aging relatives without sacrificing an income. One of the points I wanted to make was continuous leave is a single block of time, such as 10 weeks to recover from a heart surgery. Intermittent leave is taken on hourly or daily basis, such as every Thursday, as an example, to receive chemotherapy. Reduced schedules is when a worker reduces their normally scheduled hours, such as working from 9 to 2 instead of 9 to 5. And something to really put emphasis on is income replacement is very important, especially in situations where employers don't provide any type of leave on their own. So areas that I thought were important to highlight.
Thank you so much. And I think it's important, even though we provide up to 12 weeks of benefits, what we're seeing is people are using on average about 7 weeks. So if you think, if you're the employer and you're worried about losing your employee, you're not going to replace somebody in 7 weeks. It's a much better investment to support and work with that person who's been working with you, who's fully trained, and to give them that time and the grace they need to recover or deal with their situation. They're going to come back happier.
Exactly right.
So I think those are important things to know. So Representative Reyes, one of the primary reasons people use benefits is for their own serious health condition. Can you please talk about why paid leave is such an important resource to individuals who are receiving treatment for or recovering from a serious health condition?
Thank you very much, Aaron, for the question. And I am State Representative Geraldo Reyes from the 75th District, Waterbury, Connecticut. The Connecticut Paid Family Leave bill was so important to us, and I think that when we do sessions like this, it's immensely important because we pass bills and they come into law, and sometimes we don't do the due diligence that something like today's doing, where we're actually trying to get into the weeds, if you will, how this actually works. And the beauty of this bill is it's not only for physical ailments but also mental ailments, and at the same time makes you aware that it doesn't necessarily have to be yourself. It could be a loved one. It could be somebody that you believe you actually treat like family, and the emphasis is on the employee making that determination, and not the employee is making the determination, and not actually the employer. It's your mental health. It's your physical health. You're calling the shot as to when you need this, and one of the reasons why I think that this is so important and why we need to continue to advocate and get the message out is because for far too long historically, employees were afraid to actually come forward with their ailments, especially when there was a loved one. So I think that one of the most important pieces of this law is the fact that it's expanded to not only physical and mental, but also beyond your family, and also have the reason could be that you're expanding your family. It could be a military reason why you're actually asking for this, and or not only that, but also in that most people don't even talk about, it's family violence. There are very specific reasons that carve out for the reason for actually using this. So I think it's an important piece of legislation, and I was happy to be part of it. So thank you for the question.
Thank you so much.
Mm-hmm.
Representative Santiago, we've talked a little bit about how important it is to have caregiver leave, which is leave when you are caring for a family member. Would you please share with us what you think is important for people to know about caregiver leave?
Thank you. Thank you for the question. I'm Representative Hilda Santiago from the great city of Meriden, center of the universe, because we always have an argument with Waterbury. But that's right. But I think it's important that the caregiver is the one that is a trusted member, mostly from the home or a friend, or someone that was like a sister to you, or a great aunt that is like a grandmother. And it's someone that, it's a loved one that is taking care of the person that is ill, and they can get paid for it. So it's always important that they have access to paid leave to take care of their folks. We have to be able to also, if the person is a Spanish speaker and it's a family member that is, they feel more comfortable talking in their language. And that's also what's great about it. But I want to take a minute to talk about a constituent that I had in Meriden. It was a young man that had custody of his daughter. And she was 9 years old, and he had a lot of appointments for her because she had a certain handicap disease. And he was always in fear of losing his job. And he had many appointments. He already had used a lot of his vacation and sick time and FMLA. And this was, you know, and he was always the only, and he was the only caregiver she had because he was raising her. But this is a great opportunity for working families like him to be the caregiver and also get paid, because if he doesn't work and he's run out of a compensation time, then he's still getting some kind of a paycheck to help pay his bills so he doesn't get evicted. And it leads to housing, it leads to food insecurity. So it's a trickle-down effect. So we have to make sure that we're helping working families. We have to make sure that they have an income replacement, and also the trust is very important. And again, the cultural and the language tied is so important when you're the caregiver, because people feel more comfortable So this was a no-brainer when we had to vote for this, because we needed something extra. And it's also, a lot of our small businesses don't have paid time. So this is a good way for us to really get out the word there, especially as the Hispanic population is growing in the state of Connecticut with a lot of small businesses. They need to know about this program to help their employees. If somebody needs caregiving, that this program is available to them. So this was something that I was really proud about voting for.
Thank you so much for that. And I'm so glad you mentioned the really true and worry and concern that people have that if I'm taking too much time off of work, I'm going to get in trouble at work. And so the Family Medical Leave Act, which is the law that gives you job protection, protects you from an employer who gives you a hard time because you're taking your FMLA leave, or makes fun of you, harasses you in any way for taking your FMLA. And we were able to amend the Connecticut Paid Leave Act to be really explicit that you can't retaliate or harass against a person for applying for or inquiring about Connecticut paid leave either. So these benefits exist, these laws exist to protect us, and so there's also protection. So you can't be harmed because you're using these legal benefits. And if you think you have a problem, the Connecticut Department of Labor has a complaint line and a website we can go to file a complaint, and they will investigate. So we want people to know that these benefits exist and they don't have to worry about using them. Now let's talk about something a little bit more fun, which is the pregnancy side of things. So I think people are mostly thinking about when they thought about time off for FMLA or paid leave were the happy reasons, the pregnancy and childbirth, and pregnancy and childbirth. But Representative Santiago, we know that there are some severe disparities with regard to maternal health, particularly for women of color. We think at Paid Leave that we're here to help address and resolve issues and to improve maternal physical and mental health outcomes. Can you please talk about how it can be a resource for pregnant people?
Sure. Let me put this on. Sure. The research shows that 1 in 4 women return to work 2 weeks after giving birth, which is not enough time for you to really bond with your child, take the time and really take care of the baby, take care of yourself. So, the Connecticut Paid Leave will be a way for women to use this resource in order to stay home. Again, when you use up your sick time, your vacation time, your FMLA, sometimes you still need more time to recover. And what if the baby is sick? What if the baby needs more time, more appointments? So the Connecticut Paid Leave, it helps you with that time needed to recovery. We also need to make sure that we give women enough time, especially women of color, the time to recuperate and make sure that they take care of themselves, that they have their appointments. And this only helps, with the maternal and infant health and the physical health and the well-being of the family as a whole. So, pregnancy and childbirth, again, is because of the severe disparities in the state of Connecticut and around the country, we need programs like this to help women. And also for the father to be able to take time off and spend with his family and do the bonding and also help with the caregiving so that he's part of that process and he doesn't have to worry about taking the time and not getting paid for, because at that time he's the breadwinner. But also if the woman is working, and most women now are working, you need 2 incomes in order to survive in the state of Connecticut. So this is a great program for them, again, to help them to recuperate for the physical and mental health outcome, for maternity outcome, and also to make sure that the family as a whole is recuperating from the whole process of pregnancy. Because some women have it easy, but some other women don't. But to go back to work after 2 weeks, that's really, really severe. And we should be able to stay at home 3 to 6 months. And in other countries, sometimes they give you paid leave for another year, you know, and you get paid for that, like in Canada. We're like really behind the times, and this is just a step in order to start changing those rules and those laws for women.
Absolutely. You know, Representative Sanchez, Representative Santiago sort of teed up the next question for you, but it's important for both parents to be able to be home after the birth of a child. Based on your experience or what you've heard in your district, can you talk about what it means to be the father and being able to use paid leave to be with the new baby in the home?
Thank you for the question. Actually, I'm going to be a first-time father myself, with baby Lennox being born in February, and my wife and I are actually in the process of talking about paid family medical leave, and it is a blessing, right, to find comfort in knowing that there is a window in which she can be with child and not have to worry about any sort of being bogged down by the financial issues and ramifications that can come with not being at work. Paid leave can be taken by both parents, as Representative Santiago alluded to bond with new children or a new child, and to be with their newborn baby or an adopted child. An important point is that parents don't have to take the time at the same time, which is something that my wife and I have been discussing. And I have actually worked with constituents who have asked many questions about this process and in which they can take that time. CT paid leave also applies to adoption and foster care. It can be used for pre-placement or pre-adoption activities, as well as travel for court proceedings related to placement and adoption. All valid points and all things that we should certainly take into consideration when we're talking about that bonding process.
Absolutely. We do see a lot of parents who ask us, how do I take this time? And if you're trying to set up good child care for your child, that's not always the easiest thing. And so sometimes it's, well, one parent's going to be home for a little while, goes back to work, the other parent stays home for a little while, so the baby's home for a nice long period of time before they go into daycare, so you have that time to set up child care. So you can use bonding up to 12 months after the birth or placement, so it does give you some flexibility in the family. I do want to thank Representative Reyes for mentioning some of the other reasons that people do take leave, including military caregiver leave, which is a special type of caregiver leave available if you have a family member who's been injured in the line of duty on active duty. And then there's also something that nobody knows about. We're trying to change that. It's called qualifying exigency leave. So if your parent, spouse, or child is in the armed forces or gets a notice or a call of deployment, you as the worker can take time off to deal with some of the things that you need to deal with because of that change in your family situation. Maybe it's going to the bank to set up new financial arrangements, or going to the sending off ceremony or the welcome home ceremony, dealing with some of those changes. And then, of course, it's really important to know that with family violence leave, you can take job-protected time off and get income replacement benefits for things like having to relocate or having to go to court because you need to get a restraining order, or you're dealing with some of the legal issues associated with that domestic violence situation. So we want people to know that these resources exist as a safety net while you're dealing with these difficult situations. Now, I really appreciate your time today, and I think we've talked a lot about some of the things that are available. We are here to answer questions. If anyone in the room has any question, you feel free to come up to one of the mics. We're happy to take that question if you like. We've got some. So just turn on the little button with the little face on it so that the recording can hear you.
All right. Can you hear me?
Yes.
All right. My name is Evelise. I actually fall into that percentage of mothers who went back to work at 2 weeks.
Oh, gosh.
So with my 15-year-old. And throughout that time, I was able to breastfeed him. I think he drank formula maybe a handful of times. And I wanted to know, how does paid family medical leave support breastfeeding and transition back into the workplace. I know I actually discovered a lot of laws and actually had to push certain employers. So throughout that time back in 2008, I was, breastfeeding. So I wanted to know if this legislation also does support that. I mean, I know bonding time at home is one thing, but if there's anything else with that, or if that's something that we should consider.
So great questions. So there is a new federal law, that's the Pregnancy Fairness in the Workplace Act, which supplements some of those existing laws that were in place in 2008 that requires employers to, Connecticut already had some of these laws in place, so it's not necessarily new in Connecticut, but it requires employers to make sure that the woman who is either nursing or expressing milk in the workplace has a safe, clean, private place that's not a bathroom with a locked door, so that you can take that time that you need at work to express the milk or to nurse if that's possible. And so that is a really important benefit that is available to workers now. The paid leave program doesn't have as much to do with that part directly because you have that time at work. But if you're in a situation where
You have to meet with a lactation consultant maybe, or things like that.
Yeah. So if you needed to meet with a lactation consultant before you go back, or if you need it, even you're going back to work but you need time off from work to work with a lactation consultant, that would be a healthcare provider. That could be intermittent leave or reduced schedule leave, like Representative Sanchez mentioned. So you're leaving work early because you're going to these appointments, or maybe you're leaving work early because the way your baby's schedule is set up, it would be easier if you could get out at 4 instead of 5, because it's really hard to express milk on a bus. I'm going to tell you, you just don't want to do it. So like those are the kinds of things that you might be able to use the leave for. But it is really important to have that, in addition to the time at home, to really set up that successful breastfeeding.
Yeah, that's actually something I did not know. I don't think a lot of people would have known you can actually set up your schedule that way either. So thank you for that answer.
Absolutely. Speaker Donovan.
So nice to see everybody here. Thanks for this. I just want to say, first of all, how proud I am of Connecticut to have this program. It's a great program, and it's only in operation about a year, 2 years.
We're just under 2 years in paying benefits.
Right, and I attended the hearing in the Labor Committee this past year where we talked about the changes that need to be made. Hopefully, we can pass some of those things this year. But I just want to say how great it is, and I actually got from the agency some flyers in English and Spanish to get the word out in our community. I'll probably go and be working with my state representative to hit my old neighborhood. They kicked me out of redistricting, kicked me out of my old district, so I yearn to go back and see the people. But I think that's one of the issues, getting the word out to people. And I was wondering if there's any plans for like public service announcements or on television or various ways to get the word out. I mean, certainly word of mouth is probably the best way. Passing out these flyers, talking to people and explaining it to them, but leaving them at libraries and churches. I think I talked to Representative Santiago about that, but figuring out ways to make it everybody knows about it. As Representative Santiago says, my son lives in Vancouver, Canada. Everybody there knows about it. It's like everybody. And here, I think a small percentage of the population knows about it. And I think we need to work to make sure everybody knows about it so they can take advantage of it. And so employers go, oh, yes, that's part of the fabric of our society. We should do it. So congratulations, everybody, doing that. And I'll be happy to help get the word out.
Thank you so much.
Thanks.
So we have a wide-ranging and constantly evolving outreach program. To the people, the architects of it are sitting behind you. So we do have television, we do have radio. We are, I have some tips that I'm going to be getting from my colleagues in a moment for other places to do outreach. one of the things that everyone can do is sort of like and subscribe, right? We have a presence on Facebook, on LinkedIn. So look for us and share the information. We also have a podcast. We're up to 24 episodes, I believe, on more than that. We have over 24 episodes on our paid leave podcast, which is run by one of the folks on our team, Nancy Barrow, who some of you may remember from her time on the radio. And so there are things that everyone can do, and we'd really appreciate it if you did sort of like us and share the information. I think sometimes this information is more likely to be retained if you're hearing from a friend, from a trusted member of your community, more so than just seeing it on the billboards, even though we have those too, and buses, and television, and newspapers. So we're trying to get the word out. We always accept suggestions for other places. Yes?
Have you guys attempted Instagram, Snapchat, or TikTok?
Yes, all three. So we have ads on TikTok. There are some restrictions about state agencies creating content on TikTok, but we can do ads. But we are also on Instagram and Snap. So
I'll subscribe now and spread the word. Thank you.
fabulous. That would be great.
And if I may take the panel's indulgence, I'll take a picture with you and put it on my Facebook today.
There you go.
Let's see. Give me a nice smile, everybody. Okay. Perfect. All right. See you.
Thank you.
Thank you.
Oh, I think we have a question coming. Yes.
Good morning. Thank you for having the conversation. My name is Werner Ollanadel. I work as a staff person for the Commission on Women, Children, Seniors, Equity and Opportunity. I work on the issues particularly that impact the Latino community. Number one, thank you again and for the program that was passed by the law. So thank you to the legislators for helping it pass. I just want to see if I can get a clarification to some of the benefits. It is my understanding that you can apply for the benefit, but that does not mean that your job will be guaranteed if you get the benefit. Could you explain that so that it's clear to people whether or not their job will be guaranteed when they go back to work?
Thank you so much for that question. So there are two separate laws. There's the FMLA, which is the law that provides that job protection so that your job is guaranteed to go back. And that is something that you apply for with your employer. Just like the Connecticut paid leave applies to all private sector employers with one or more employees, accepting private schools, Connecticut FMLA does too. So pretty much everybody in the private sector world is covered by Connecticut FMLA. And so if you have a reason for leave, you go to your employer and say, I need FMLA, and work with the employer, and they would make sure that you meet the qualifications, which is basically working for them for 3 months and kind of giving you that job protected piece. And then for making sure that you have money coming in while you're not working, you would apply at the CT paid leave program for the income replacement benefits. You can get benefits from us even if you're not necessarily eligible for job protection. So say you just left employment and you're looking for a new job, or you've got a new job but you've only been there a month, you could still get income replacement benefits from us even though you may not have job protection under FMLA. So they're two separate rights, but they're very closely linked.
Thank you for that. I have a follow-up question.
Sure.
My last question too. In terms of improvements or to capture more employers or employees in the future, in the Latino community, we have a segment of our workforce working in agriculture and also obviously in the food service fields. And some of them may be families that are working 2 or 3 jobs, but they're not full-time employment. Or even in the agricultural fields, you may have seasonal employees that are working only part-time during the year or during the year. Would they be included, and if they're not, are there any projects to increase the eligibility in the future?
So they are included, and that was something that I really give credit to the Labor Committee for making sure that the eligibility for the Connecticut Paid Leave Program is broad enough to cover part-time workers, seasonal workers, per diem workers. When we look at the earnings requirement, we're looking at all of your earnings. And so it's not a per employer. So if you have 3 jobs, which many people have to piece together, we're looking at all of that employment for determining eligibility and for determining the benefits. So we're trying to make sure that that this is a program that covers as many workers as possible. And that's also one of the reasons why our program applies to folks who are, even if they're not currently employed. Because if you're a seasonal worker, you're going to, and you have the time to schedule your, knee surgery, you're not going to do it in the middle of your season. You're going to do it when the season has ended. And it wouldn't be very good if we said, oh, well, gosh, we would have given you this money if you had left your job, but we won't now. So, if your season runs from May to October and you need to schedule that surgery in November, that's okay because you're still within that 12-week window. Thank you for your question.
I just want to say that the outreach in the community is very important. And when you do the outreach in the community, you have to send people that reflect that community and are able to speak Spanish, or are you doing it into the Asian community or the Black community, any kind of community. The representation has to be there, and you have to reflect that community, because that's what people trust, and you have to gain their trust. So when you have small businesses, you have to do the outreach one by one. When you go to the bodegas and the churches, like it's been mentioned, restaurants, the barbershop, the salons, this is, in order to get this program out to everyone, this is how it has to be done in the beginning. And when you go to the Spanish radio, it's not just putting ads in there, but having someone talk to the MC and somebody that speaks Spanish, because it does take a long time to translate, and the translation is not always the same. So, even to get captions for this round table, we couldn't even get that. And this is the state of Connecticut. And I think it's something that we are going to concentrate with the the Just Forum Connecticut Puerto Rican Latino Caucus, is that when people come to hearings and people are watching this, that it's also available in Spanish, because there are a lot of people that do come here to testify, especially about housing and health care and home care and stuff like that. So we need to set the example as a state to make sure that that's getting done. In the radio ads and the conversation, people do listen to more radio in the Latino community than they do Facebook, than they do Instagram. I mean, a lot of the young people do stuff like that, but people, when they're driving in their car or they're at home, they do listen to the Spanish radios. And that's where the in-person conversations need to be had, because people don't know what to do if they have a child that's disabled and they need to take time off, and they're afraid of not taking the time off because they might lose their job again. So we need to do a wider outreach plan into the Black community, because this is also has to do with pregnancy and childbirth. And we have to do a plan for the Latino community and the Asian community, because we're not all the same, and there's different ways that media is brought to them. And if, I don't know if, it should have been included in the budget, but if we need to make the budget bigger, then, we need to know about it, because the Hispanic community in the state of Connecticut is already 18%. We have 640,000 counted Hispanics in the state. That's not even counting the underground or the non-citizen population that didn't respond to the census because of their fears. Mm-hmm. Because when you send people door to door and you don't reflect that community, the first thing they're going to think about is, oh, is that from La Migra? Or is it from del Estado, or is, from the state? So it to me is important because I do a lot of outreach in my downtown area because most of the bodegas and most of the businesses and restaurants there are all Latino. And when I was doing the COVID, taking the test kits to them, it was I that was taking them to them because they already know who I am. So this is very important. And one other question I wanted to ask Aaron really quick is the Connecticut paid leave part of, and we might have mandated, I don't remember, that if you get a job, right, and you get your personal policies, is the Connecticut leave plan also part of those policies? And that's what's important because that way, if you have FMLA, you have another alternative with an explanation, so something that you can read that is available for that employee that is starting a job. So
Yes. So to that last question, and absolutely be coming to you after this to get more suggestions from you for outreach. But for employees and employers, it's important to know because this is their obligation. Employers are required to provide a notice to all new employees and then that same notice annually, making sure the employees have information about Connecticut FMLA and Connecticut paid leave. So the Department of Labor has created a template that employers can use, but it's important because if you're not in the moment, this is the kind of thing that you're like, oh yeah, that's nice, and you kind of forget about it. And then if you're in the moment, you've got a lot going on. And so it's important to have that at least yearly reminder that, hey, this program exists and here's where you can find out about it. And so one of the things that we do when we talk to employers is to remind them, hey, did you send out that notice yet? You've got to send it out every year. Just put it on the calendar and make sure that your employees have access to it, whether it's in the break room, by email, however you're getting your employees' information, make sure that that's on the list because we need employees to know how to get benefits from us. We need them to know what their rights are under FMLA and what to do if they're getting denied. And so those are all things that we encourage DOL enforces. Well, if anyone has any last minute, I'm going to give you an opportunity for any last minute statements or comments.
Thank you, Ms. Aaron. No, I just wanted to share that these type of outreach opportunities are very, very important for our community. My colleague, Representative Santiago, pretty much said what I was thinking. We need to repeat the message often and in their native tongues. And as a person that's pretty well invested in the community, I shared with you, Aaron, that I can assure you that a lot of folks in my district do not know this, and we need to drill down a little deeper. And I think Representative Santiago is spot on. We need more trusted voices in the community, number one, and number two, I think that when people see people from the community that they recognize, they actually tend to listen a little bit more, if you will, and buy in. And I'm thankful that you shared a number of actual folks that have used it, and 80,000 folks have already used it. And I'm interested in, do we know the demographics? Do we know the actual breakdown by race of the people that have actually used it, which will tell us where we're hitting it or not hitting it. And I still believe that many Hispanics are not using this, A, because they don't know about it, B, because they still have the fear of retaliation, if you will, and the onus is on us to continue to do this type of outreach to let them know that you're protected federally and with state law.
Absolutely.
And thank you for the opportunity.
Thank you. I will tell you, so we started by capturing information based on location, and so we have claims from every town and city in the state, and we can share the frequency of which is used. We have just started collecting race and ethnicity information, so we don't have accurate data on that yet because we're only now just starting that. There was a debate about concern that people would be afraid to use the program or be worried about disclosing that information, but we can't do our jobs properly and know where the gaps are without that information, and so we've started collecting that information as well.
I also want to state that we need to also use, which I forgot to mention, the nonprofits at the local level. So when people are applying for energy assistance, or they're going for food pantry, or for going to other programs within the community, those are the trusted people that they know. So when they apply for energy assistance, they give them a pamphlet about the Connecticut Paid Leave Program. They might not have a question then, but they might have a family member or friend that might have a question. And if it's in Spanish, that'll be great. But those, use those resources within the community and meet with them. I know there's a whole bunch all over the state. I don't know how big your staff is, but
We're not that big.
but the community action agencies, again, putting in a plug for them, know the community well, because that's where people go to get their services and get more resources. Leaf pamphlets at City Hall. The fairs are also important to have like the farmers market, like for maybe next year, because they're almost over. I know in Meriden, Saturday's the last one, but the farmers market is a place where you can have a booth. A lot of them are free, where you can set up a table. Or it's, like in Meriden, you only pay $10 but for the nonprofits, they don't pay. In the state offices, they don't pay either. But there's a lot of people there that like going around and picking up information. So there's so many ways that we can infiltrate the community. I've got some more too, but I'm going to save it for another time. But getting the word out is so important, because this is a great program and it's great for working families. And someone knows somebody that could have benefited from this program and they didn't know anything about it.
Yeah,
Thank you.
absolutely. Thank you for those suggestions. I feel like you might have been listening in on some of our meetings. Yes, I see you have your hand.
To follow up with Representative Santiago's statement, because that's actually genius. So how would you invite a representative from Connecticut Paid Leave? How would nonprofits do it, or outside agencies, if they happen to be hosting an event?
So just in case people couldn't hear, the question was, if you are an outside agency or a nonprofit or having an event, how would you invite us to come? So we would love for you to do that. If you go to our website, we have Contact Us. So if you go to ctpaidleave.org and go to our Contact Us button, one of the options is to request a webinar or event, and so you would just submit that and let us know. We are a small team, but we're committed, and Maddie and I were at the Hebron Library last night. Maddie and Jess were in Middletown 2 weeks ago. We're going to be at the Breast Cancer Walk on Sunday. So we get out and try to get out. And so if there's events, if there's activities, please let us know and go to ctpaidleave.org and invite us. So, Representative Santos, do you have anything you wanted to add before we close?
I just want to say thank you to everybody who participated in this process and for all the great questions that were asked today, and some of the comments and suggestions. And let's just keep working on collaborative efforts to ensure we're getting the message out on CT Paid Leave.
Absolutely. Thank you so much for being here today.
Thank you for having us.
Thank you.
Thank you.